Good morning. My name is Dr. Parth Goyal and I am a consultant psychiatrist at Parth Hospital Ahmedabad. Today, I would like to talk to you about the most common psychiatric illness, that is depression. First of all, I would like to start by defining the types of depression. Depression is usually categorized into two types, external depression and internal depression, which is scientifically known as exogenous depression and endogenous depression. External depression, as the name suggests, is a depression that is caused because of changes in the environment. For example, if during COVID you went through a financial crisis or if you went through a crisis of health, then the resulting state would be known as externally induced depression. The other type of depression is known as internal depression, that is endogenous depression. In this state or in this type of depression, the patient sleeps normally one night and the next morning when they get up, they are apparently depressed for no real reason. There is no external factor, there is no environmental factor, there is no situational factor which can explain their depression or their various symptoms of depression. So, it is not necessary that everybody will have an environmental trigger or will have a situation or will have a reason for developing depression. Sometimes depression can also happen without any reason, just because of the biochemical changes that take place in the brain. To give you a brief overview of the reasons for developing depression from a biochemical point of view, there are three main neurotransmitters that are involved in the pathogenesis or in the causation of depression. They are serotonin, which is referred to as the happy hormone, norepinephrine, which is usually coding for energy, which is coding for your excitement levels, which is coding for your ability to motivate yourself, and last is dopamine, which is actually the chemical that is responsible for you experiencing pleasure. When each of these chemicals get reduced, they cause a very different set of symptoms. Most commonly, depression is confused with other psychiatric illnesses, or rather, most other psychiatric illnesses are referred to as depression. Please note that depression is different from other mental illnesses such as schizophrenia, bipolar mood disorder, anxiety disorders, obsessive compulsive disorders, eating disorders, etc. Now, let us come to the most common symptoms of depression. Now, in order to diagnose depression, the time duration has to be a minimum of 15 days. That means the patient has to experience symptoms continuously and consistently for the past 15 days. The patient has to either experience sadness of mood, that is, they are not able to regulate a happy mood, they are not able to be happy, they are not able to be cheerful. And second, the patient may or may not also have something known as anhedonia. Anhedonia refers to the lack of being able to experience pleasure or joy in things that we previously found pleasurable. For example, if guys like to go out with friends or they like to watch a sports match or they like to watch a movie, now doing the same activities will not be as pleasurable as it was before. For girls or for women, it could be going out, shopping, watching sitcoms, etc., which they previously found pleasurable and now are not able to enjoy it because of the onset of depression. The other symptoms of depression include unable to concentrate, unable to focus, unable to stop their thinking, unable to stop excessive thoughts from coming in, being amotivated to do anything, feeling very weak, feeling very lethargic, feeling exhausted on doing small routine activities or tasks. In severe cases of depression, patients might also experience a sense of severe guilt or sense of worthlessness, hopelessness, and helplessness, which may lead to the presence of suicidal thoughts. In severe cases, patients also attempt to end their life because they do not see any option of coming out of this depressive state. Patients might also sleep less or more depending upon individuals, and appetite usually goes down in depression where patients are not interested in eating and they do not derive any pleasure from consuming any kinds of foods. So the question is, when is depression diagnosed? If you have any of these symptoms, it is important that you consult a psychiatrist. Depression is not just diagnosed because there are certain symptoms present. Depression is diagnosed when these symptoms are of sufficient intensity to affect your work, to affect your personal life, and to affect your social life. Once depression is diagnosed, it is usually categorized into mild, moderate, and severe depression. Moderate and severe depression require immediate clinical attention. In most cases of severe depression, the patient does present with self-harm thoughts or thoughts of hurting themselves. Depression is also hereditary in nature. There is a very strong genetic component. If one or both parents have suffered from depression, there is a very high probability that the kids might also experience a clinically depressive illness in their lives. Now, what are the treatment options in depression? The treatment options in depression depend upon the severity of depression. If the depression is very mild with minimum effect on routine life, then depression can be treated conservatively, that is through the use of psychotherapy. Please note, psychotherapy is different from advice. Psychotherapy is a structured clinical process where the patient has to interact with the therapist to understand their patterns of thinking which are causing them to be depressed. Also, psychotherapy has a role only in external or exogenous depression, which is caused because of a change in an external environment. For example, a financial crisis, a health crisis, a relationship crisis, etc. If the depression is moderate or severe in category or in variety, the first treatment option is medication, and psychotherapy is not advocated as the first line treatment option. If the patient has severe depression or the patient has self-harm thoughts or tendencies, then hospitalization is advised in order to ensure that the patient does not end up hurting themselves. Psychotherapy is used only as a second line option in patients with moderate to severe depression, especially after their symptoms have come into control. In order to control symptoms of moderate and severe depression, medications, ketamine infusions, electroconvulsive therapy, etc. are the treatment of choice. Now, one of the most frequently asked questions is, once I am diagnosed with depression, do these medicines go on for a lifetime? And how long is the duration of treatment? When you are diagnosed with the first episode of depression, the usual course of treatment is anywhere between 6 to 12 months, depending upon the improvement that you see. Once you have completed this course of treatment, the medications are reduced and stopped, and we give you time to see whether you are doing well with medication or not. If there is no relapse of the illness, or if these symptoms do not happen again, then medications are not restarted. If you have experienced multiple episodes of depression, the probability of lifelong medication is very real, and it is absolutely probable that you might have to take medicines for life. Coming to another more frequently asked question is, what is the role of psychotherapy in depression? I don't want to take medicines, I want to do counseling. As I said earlier in my video, counseling and advice are two different things. Psychotherapy has a very strong role in depression, but the role of psychotherapy is to increase a patient's internal resilience or internal strength so that they can fight off any unfavorable environment. Psychotherapy is not used in patients with moderate to severe depression as a first line treatment option. Medications are preferred to reduce symptoms. Once symptoms are reduced, psychotherapy can be used to improve resilience, to improve core strength of thinking so that future episodes can be stopped or prevented. Now, coming to the newer treatment options in psychiatry. The newer treatment options in psychiatry are primarily three. First is electroconvulsive therapy. We will be making a separate video on electroconvulsive therapy, which will have all the details of the procedure. In this video, I just would want to talk about the indications of electroconvulsive therapy. The indications of electroconvulsive therapy are severe depression with suicidal ideas or attempts, recurrent depressive disorder, and treatment-resistant depression. The second option is known as ketamine infusion. Ketamine is a newer FDA-approved medicine which is used to treat both resistant depression and severe depression with acute suicidal ideas. Ketamine is given as an intravenous infusion, which is an OPD procedure, and it is rapidly acting and acts specifically on reducing suicidal thoughts and impulses. It has a very strong effect on mood and can bring about a sense of happiness and a state of happiness much earlier than conventional antidepressant drugs can. For more details on ketamine, we will again be making a separate video. And the third is called RTMS, which is repetitive transcranial magnetic stimulation. RTMS is a treatment of choice only in long-standing severe depression which is not responding to medication. RTMS is a non-invasive treatment option. RTMS does not have any major side effects in depression. Usually 30 to 40 sessions of RTMS are given in patients with long-standing non-responsive depression. Again, we will be talking about all these three newer treatment modalities in a separate video, giving detailed accounts of what each one constitutes. If anybody watching this video has been experiencing depression or has experienced depression, I would recommend that you visit our website www.parthhospital.com for more details and to understand about the newer treatment modalities. I would also urge anybody to consult their local psychiatrist if they feel that any of these symptoms of depression are present. I hope this video has been helpful. Please like and subscribe. Thank you.